Good morning. I'm Randy Turner, the Accessibility and Disability Rights Coordinator for the Governor's Committee on People with Disabilities. Today we have with us Mr. Sean Jackson from Disability Rights Texas, and he's going to talk about the vaccine project and helping people with disabilities gain access to the COVID-19 vaccines. Mr. Jackson, welcome, and thank you for joining us today.
Thank you, Randy, and it's always sincerely a pleasure whenever I get to speak to persons about this project that we're doing. It's something we're immensely proud of. We think it's very important and it's very timely in light of the ongoing pandemic that we're all trying to navigate or get through as a society right now and as a state. So I'm going to speak again, as Randy stated, about the Disability Rights Texas Vaccine Project. And what we are attempting to do is, with our project, is help individuals with disabilities access to COVID-19 vaccination. I think there was an assumption by maybe the greater public that everyone can just easily go to a pharmacy or go to their doctor or whatever, or go get to one of these mass vaccination sites and they could have gotten their vaccine. As I'm sure many of us on this call know, it's not that simple for individuals with disabilities to always access things, and that obviously that would include this vaccination. So just to give you an overview of what we're doing, we are in a partnership with ACL. That is one of the funding entities for my organization, Disability Rights Texas. And let me explain what Disability Rights Texas is for those of you that don't know. Disability Rights Texas is the protection advocacy agency for persons with disabilities for the state of Texas. Each state is mandated to have an agency of that type. And one of the things we do, amongst other things, is we do a lot of healthcare and we do a lot of accessibility law. So that's particularly the team that I run. I run the community integration healthcare team. So what we were trying to do is make sure that our constituents, for lack of a better term, were not left behind when this particular vaccine rollout happened. So a partnership between ACL and the Centers for Disease Control, also known as CDC, to increase vaccine access for people with disabilities and older adults. And as we know that many persons with disabilities have pre-existing conditions that are associated with severe illness due to the COVID-19 virus. And Disability Rights Texas received funding from, again, one of our funding partners, ACL, to help persons with disabilities overcome these barriers and gain access to the COVID-19 vaccination. So what are some of the types of barriers that were identified by our funders, but also by us as the PNA for the state of Texas, Protection Advocacy Agency? The biggest one we found were that individuals who were homebound, those particular individuals, persons who are homebound, those particular individuals could not get out of their house. They could not, perhaps could not tolerate standing in a line, or they may be immunocompromised, and therefore they can't really go around others to get, groups of people to get the vaccination. Also, something I don't think that was considered when they were talking about homebound is we have individuals who may have severe anxiety. They're hearing about this pathogen that's floating around, and it could lead to a bad outcome, including up to severe illness, hospitalization, or death. So it's you could see how that could exacerbate someone who's already prone to have severe anxiety, so they may not want to go out. So we consider those individuals homebound as well. Persons lacking transportation, persons living in remote locations. Our state is very geographically, has a very large footprint and very geographically diverse. We've found that there are individuals with disabilities or just living in remote locations where they can't even access healthcare for more than 2 hours. I've spoken to folks, they're 2.5 hours from any type of physician or any other type of hospital or healthcare, period. Persons who have difficulty overcoming the technology divide. We said a lot with our seniors, but also other individuals, they just have trouble navigating this new technological era that we've entered into. And I have a saying that, for instance, if you are thinking about how easy it is maybe for you to do something on your smartphone, I would say if you're going to just equate it to, say, if you had a 5-year-old, a 5-year-old can dial 911, but they can't necessarily go online and order a pizza from Pizza Hut or something. So what I'm saying is that we have older folks who just aren't experienced with technology. We have some folks who have cognitive issues, but for whatever reason, they just have trouble overcoming the technology. And a lot of this stuff is available online. So we help navigate that. Persons needing accommodations such as an attendant to escort them to a vaccination site. We like to emphasize the ability part of the disability word. So we don't want to necessarily assume that someone, because they have a disability, can't go to the site or doesn't want to go to the site. So one thing we'll do is to try to accommodate that, is to, if they do want to get out the house and they do want to go, they just need some help, make sure we have an attendant to help escort them to a vaccination site. And then there's, I don't have to go over this too much, vaccine hesitancy. That's in the news. Everyone's aware of that. But also a new term that we've coined at Disability Rights Texas is vaccine apathy. We also see that it's not only just persons who are resistant or have questions or for whatever reason they don't want to take the vaccine. I've run into a lot of persons who would otherwise take the vaccine. They don't question whether it works, or they don't question its safety or anything. They don't get around to it. They have other things they're doing. They don't think it's that important. So they just don't take it. So that's apathy. So just a little bit about our particular project. We have partnered with DSHS, DSHS, which stands for Texas Department of State Health Services, and TDM, that stands for Texas Department of Emergency Management. And through them, we are able to have a direct line to getting individuals that contact us vaccinated. We can arrange for vaccinations of individuals with disabilities anywhere in the state. And so that goes back to, let's say, if you have someone that's homebound and having those other challenges, and they, maybe they can't navigate the phone system or the internet, we actually have persons who will assist with that. And we can also arrange for pop-up vaccination clinics. We need a minimum of 5 persons to qualify for a clinic. But if we have 5 individuals, we can have a clinic. And the question I'm asked a lot is, does this have to be specifically persons who are disabled? Well, yes and no. For instance, if someone told me they had 10 people in a household or something, or 10 people at some site, and if 1 or 2 of them had a disability, we can arrange to vaccinate everybody there. And somebody may say, why? Because if you think about how this, why don't we just focus on a person with disability? Because the way this works is, if it's caretakers, if it's family members, if it's just someone who comes and visits, we do know that even the vaccine is not a suit of armor. It's not a plastic bubble. It's the vaccine, I like to equate it to a raincoat. By that, I mean, you can be vaccinated, but there's still some level of risk if you're exposed to being constantly exposed to persons who are not vaccinated. So we've taken a position that we will vaccinate everyone in the home or at the organization. As long as we have one person with disability, we'll vaccinate everyone, because that's just the way it works. Now I'm going to touch more about the raincoat analogy and why these vaccines are so effective and so important. But if you could keep that in mind about why I say it's like a raincoat and not a suit of armor, because I think that's what everyone's getting confused in there, and it's leading to some hesitancy that's not really founded in the science. But we'll talk more about that later. And we also do a lot of outreach, such as what we're doing right now. And we do that through our network of 20 plus participating members in a coalition that I'm going to discuss later, TPIA, which stands for Texas Partners for Inclusive Access. We have 20 plus organizations and growing to raise vaccine awareness, and I'm going to talk more about that later. So let me give you some background on vaccinations in Texas. And I think it's helpful to understand how we got here and where we are, and understanding why this is so important that we get as many people vaccinated as possible. These numbers are constantly changing. At the time that I wrote this, which is a week ago, we had received 40,417,915 doses so far, and we administered 77% of those doses, 31,172,538. Again, those numbers are changing. Those numbers should be higher now. But per the CDC, as of September 13th, 16,940,448 people, or 58% of the state, had received at least one dose. Overall, 14,246,449 people, or 49% of Texas, has been fully vaccinated. And actually the updated numbers now are 50.5% of our state is fully vaccinated, and we rank 30th in the nation as far as vaccinations out of 50. So when it talks to news, I think I have a question here. Okay, who should be contacted and how, if assistance is needed? At the end of the presentation, I'm going to give you a number that'll tell you, but here's one way. You can also email us at vaccine@drtx.org, dog radio Texas X-ray, vaccine@drtx.org. But we also have a 1-800 number that I apologize I don't have memorized, but I will give all of that out at the end of the presentation.
Sean, we have a couple of other questions as well in the Q&A box. It says, some people say the vaccine doesn't work. Why do they say
that? We don't just have a pandemic of a virus. We have a pandemic of disinformation. For instance, I've actually seen on the CDC's website where they had to say that if you get the vaccination, it does not make your arm magnetic. That may sound outrageous to some on here, or maybe most, but they literally had to put out a bulletin to folks to say your arm does not get magnetized, because there's videos on Facebook and YouTube with people putting something on their arm and it's sticking. I'm guessing they had something sticky on whatever they put on, or it was wet, I don't know, but they made something stick to the arm. So why do people think it doesn't work? It's because of breakthrough infections, and also because of the disinformation that's floating around, which hopefully I'm going to clear some of that up today. But I am going to address breakthrough infections. And well, let me do this right now, because I guess we need to set a tone as far as how this all works. The breakthrough infection thing, I think, is what's driving a lot of this today. And again, the vaccine is a raincoat. It is not a suit of armor. It's not a plastic bubble. You're not in some sealed chamber. By that, I mean, if you think of that raincoat analogy, if you were to walk out and it was a normal shower and you had on a raincoat, you would very likely get not wet at all, right? Now, if you were to walk out in a flood or a hurricane, you are going to get wet. You're going to get water on you somewhere. The thing with the vaccine is that it's like a raincoat. So if you're in an area with super high transmission, then you're getting exposed to this virus more than anybody. It's like being in a flood. So because of that, you will get some water on you. However, will you get totally wet? No. And the raincoat analogy is good too, because what the vaccines are designed to do is keep COVID-19 out of your lungs. They're not necessarily designed to keep it out of your upper respiratory tract. So head colds, headaches, stuff like that, but it keeps it out of your lungs. When it gets in your lungs, that's when it kills you. It is highly effective, like 99.9% effective at keeping it out of your lungs. Now, the other thing that's happened is we're seeing cases where people are getting sick anyway and maybe going to hospital, very few, and I'm going to talk about that. But the thing to understand about that is that if a person is already immunocompromised and they take the vaccine, it only raises them up past their baseline. So here's an example. If you are someone that's immunocompromised and you are, let's say a average person's baseline, if you looked at the median, if you just did a study of everybody, was 50% as far as their immunity levels, period. And if you're immunocompromised, and that number for you might be 10, 15, 20%. So if the person who's 50% takes the vaccine, and when you hear them say, oh, it takes you to 94, 95%, depending on which one you take, if you're already starting low, it may only take you to 45 or 50%. So you can see too how persons with underlying conditions that are immunocompromised, even if taking the vaccine, they may still get sick. But what we do know about the vaccine is that those individuals I'm talking about, if they had not taken the vaccine, they would have probably died because they're already starting low. And we also know that if you are someone at that median and you take the vaccine, your chances of going to the hospital or dying are insignificant. I mean, no death is insignificant, but the numbers are so low, and I'm going to talk about that. Another thing that's kind of thrown this all out of whack is the Delta variant. The Delta variant is, and I'm going to talk more about that. Let me jump. There's another question I see. How is DRTX protecting the rights of individuals with disabilities or vaccine adverse? Why is DRTX hiding the fact that mRNA vaccines programmed to create two distinct disabilities? I don't know how to answer that because I have not seen the science that the claim that the mRNA vaccine programmed to create two distinct disabilities that substantially limit the functions of the immune system in normal cell growth. I'm sorry, I can't answer that because I haven't seen that science. So I'm not hiding anything. It's just something I have not seen. I'm not aware of that being a fact. So, but I want to address it. So I want to, whatever questions you have, I will address them if I can.
We have some more in the Q&A box. Some might be better to answer later, but how can community partners collaborate with you?
Well, I'm going to talk later about our Texas Partners for Inclusive Access. If you'd like to join up with that, you can contact the numbers I'm going to give, and we can actually make you a part of our coalition, Texas Partners for Inclusive Access.
Okay.
That would be
And
great.
when you said 50% of all Texans are fully vaccinated, is it 50% of who are eligible? to be fully vaccinated, or 50% of the entire community? What,
My understanding is 50% of the entire community.
okay.
So I've not seen the number broken out by 12 and up.
12 and up.
Yeah.
And another question, how quick would a response from DRTX to persons with disabilities be, especially people that are deaf or hard of hearing, who inquire or request assistance to receive vaccines and potential legal assistance?
We try to contact you the same day. So, and we actually have vaccine navigators who are standing by the emails. They monitor the emails. They also monitor phones, and we have ASL. We have different, everything we do is accessible. So we try to do it the same day, and we try to make the referral to Dishes or Tatum immediately. So now let me say this: they don't always do their part right away, but we do ours right away.
Very good. And one last one, and this is kind of not really related to your project, but who started the COVID-19 vaccine?
Who started it?
That's the question. I don't know if there's an answer.
Okay. When you're saying who started it, well, that's complicated. The mRNA process has been, if I recall, they've been working on that which is the Pfizer and Moderna and some of the other ones. They've been working on that for 10 years, but it wasn't specific to this vaccine. I mean, I would tell you that a lot of different scientists worked on it. So it's hard to say who started it. I guess the pharmaceutical companies under the, I guess you say the sponsorship of the federal government and the World Health Organization, WHO, they asked for them to work on this. And one of the things they did was they started actually working on this and worked on figuring it out even before it was totally authorized and all that. So they assumed a lot of financial risk in trying to work on some versions of this, but it did go through a very stringent process as far as being vetted and being tested. And you can make an argument that this is the most tested vaccine in history because it's being used worldwide, these vaccines. So we've got a lot of data on them. And we do know that the Pfizer has, they finally finished and they've been approved now, final approval from the FDA. It's expected that Moderna will get theirs in maybe about a month. Johnson & Johnson a little bit later. So I don't know if I answered that, but I can't really specifically say who started. It's not like a movie where it was one person. It was a lot of different people. So, so let's talk about Delta. Delta is currently the predominant variant of the virus in the United States. It is far more contagious. The Delta variant is highly contagious, more than 2 times as contagious as the previous variants. And unvaccinated persons still remain the greatest concern. The greatest risk of transmission is among unvaccinated people, who are more likely to get infected and therefore transmit the virus. That's not to say that you can't transmit if you are vaccinated, but it's more likely that you will get infected. And it's not to say that you can't get infected, but it's more likely that you'll get infected, and it's more likely you'll transmit if you are unvaccinated. So let me just give you some COVID-19 numbers. And again, these numbers are slightly, maybe a week out of date because it keeps changing. But as about a week ago, 1 in 500 Americans have died of COVID since the first US infection was detected. And these numbers actually have updated numbers on this. We have 42.5 million confirmed cases. So this is actually, this slide says 41.9 million, but it's actually 42.5. This slide also says that we have 674,000 deaths. That's actually now 680,000 deaths. And if you can, I'll describe this graph that's on the left. These are the cumulative number of cases since they registered 10,000 and they started adding these up. The green line, if you can see it, which goes way, way high, higher than the others, over the 40 million mark. That is the United States. We are outpacing, if you look at the graph, we're outpacing India. And then the next one would be Brazil. And then there's other ones grouped down at the bottom, being Russia, Spain, United Kingdom. But what's sort of somewhat alarming about this particular number is that India did not even have vaccines for quite some time. So they were way behind us as far as vaccination numbers. And we're still producing quite a bit of cases, but a part of that is that we don't have enough people, even though the vaccine's available here, we really don't have enough people that are partaking in it for whatever reason. So vaccines are our best defense. Vaccines in the United States are highly effective, including against the Delta variant. The COVID-19 vaccines approved or authorized in the United States are highly effective at preventing severe disease and death, including against the Delta variant, but they are not 100% effective. That goes back to my raincoat analogy. And some fully vaccinated people will become infected, which is called a breakthrough infection, and they will experience illness. For all people, the vaccine provides the best protection, however, against serious illness and death. So just some numbers. As of August 2nd, this is the last time the CDC ran them that I saw, but I'm constantly checking. If there's some new numbers, I'll update it the next time I do this presentation. But vaccination prevents death and hospitalization. Per the Center for Disease Control, more than 160 million people, 166 million people have been fully vaccinated against COVID-19 in the United States. As of August 2nd, the United States had 612,982 deaths from COVID-19. And according to the CDC, 1,507 of those people, by my math, about 0.001% of those fully vaccinated had died from COVID-19. So you can see that the numbers of persons who have fully vaccinated that died are very, very low. The vast majority, 74% or more of the severe breakthrough cases were people 65 years old or older or had underlying conditions. And when you're talking about the 65 years or older, the thing to keep in mind is that as we become seniors and get in our advanced years, our immune systems don't quite react the same way they are. So that baseline I talked about, it starts to go down. So that's why you saw that when COVID initially hit nursing facilities, assisted livings, places where we had older Americans were grouped together, we saw that it was really horrible. And we had unfortunately, a lot of deaths. Meanwhile, going back to the slide, 7,101 people of those fully vaccinated, about 0.051%, as of August 2nd, had been hospitalized from COVID-19. So these are just the numbers. It's all I can give you. I will tell you that one of the things that my project does is we strive to stay apolitical, and we attempt to meet people where they are. We give them the information. We don't spin it. We don't, we just give them the raw data, and we'll tell them what the doctor's interpretations are. But one of the things we're trying to reach folks who are vaccine hesitant or again, that may be apathetic, they just may not think it's important, is to reach them where they are. That's one major goal or principle of what we try to do. So there's no judgment here. We don't, and we do recognize that there are persons who may have medically indicated reasons. Their doctors are telling them not to take a vaccine. That's fine. We don't, whatever their doctors say, that's what goes. We don't try to talk anybody anything outside of that. And I would tell anybody that's listening, please consult with your physician and make sure that this is the right decision for you based on you and talking to your physician. But I would say do that, talk to your physician, and don't talk to folks in social media who are just telling you stuff. Ask your doctor what your doctor thinks. They know more than anyone. So just to give an example of vaccines and how they're working in our state real time. I want to use El Paso as what I call a case study. While Delta raged through most of the state's 254 counties in July and August, breaking records and overwhelming hospitals in both small, rural, and large metropolitan areas, the El Paso area, with one of the highest vaccination rates in the state, had done much better than other regions with that surge. El Paso area hospitals, which serve nearly 1 million West Texas residents, did not come close to their previous highs, which were experienced about 10, 11 months ago. You may have remembered our last big surge before this one, when the hospitals were overwhelmed. El Paso, McAllen, Central Texas, including Austin, Houston, Dallas, North Texas, they were all doing pretty poorly. And El Paso was one of them. We're having this surge again. Hospitals are filling up, but El Paso is not doing that poorly. And if you can look at, I'm showing as a graph I'm putting up here, what COVID-19 hospitalizations peaked in El Paso. You can see back in sometime around November of last year, 2020, when it peaked. If you're looking at it, you could just describe in the graph for those who can't see it. It was very high. I mean, it's at the top of the chart. And the state also came around December to January, the state then peaked very high too. But now where we're peaking again in August, September area, the state is still peaking very high, but you can see that if you look at the graph, El Paso is still very low, and it's staying pretty low. And that's because El Paso is one of the leaders in the state as far as vaccinations. So that's keeping folks out of the hospital. And why is that important? This pandemic is killing people in more than just catching the COVID-19 virus. I had a call recently, for instance, from a friend who was telling me that they were waiting in a parking lot with their child who has immunocompromised. They're having some form of cancer, and they needed to go into the ICU. And they were having to wait in the parking lot. They had been there for 5 or 6 hours because the ICUs were full. So this person there's nothing to do with COVID-19 as far as the individuals, but they were being impacted by folks going to the hospital. Just the same way we're seeing that with if someone has a heart attack, they have a stroke, they're in a car wreck. When the ICU beds are full, you don't get in, and you don't have COVID, you're fine, but you still can't get care. And I've actually talked to hospital case managers and social workers who talk to me about having to send people 3-4 states away because there's no capacity in Texas. So our numbers are getting a little better, but they're still very, very high. And this is not sustainable. We're also seeing, because of this, we tend to take for granted our healthcare workers, that they can keep this up. And my wife, for instance, is a nurse, but I can tell you that I'm not speaking for my wife. I'm talking in general. they don't really, when you call them heroes and all of that, that's fine. But they're also looking at it as like, I don't want to be a hero for the rest of my, rest of my work career. There's only so much of this I can keep doing over time. So we're starting to experience a nursing shortage that's very critical, and also other hospital shortage. In fact, we are experiencing in Texas. We are actually having healthcare workers leave the field. They're retiring earlier. They're leaving. Some of them are going to other careers. Some of them are going to other states where it's not as bad, but they can make money. And it's because they're burning out. So that's another thing that's happening when these hospitals are being overloaded like this. So another thing I want to point out is that children are far, far more vulnerable to the Delta variant. Younger people, because their immune systems tend to be very robust because they're young, they're going to school, they're getting exposed to things. So we saw when the previous variants, the original was called wild type, then you had alpha, which was the one out of England, and I think beta was out of Brazil or South Africa, but now we're at Delta, right? Those previous ones didn't really hit kids like this. And to give you some data on how much more virulent this particular one is, we saw a week over, and this was 2 weeks ago when I wrote this, the weekly count of new pediatric cases for the United States 2 weeks ago went up to 243,373. That was a 240% increase since July. There were more than 1.5 million COVID-19 cases amongst children and adolescents reported in the America all of last year. So we did 1/6 of that in 1 week. Randy, I think someone's saying they have a question. Okay, we're waiting for them to post it. So everyone, as of right now, everyone 12 years and older is eligible for a COVID-19 vaccination. But vaccination among children 12 to 17 is lower than in older groups, according to the CDC. So I get a lot of questions about boosters. As of last week, Pfizer, because they had more data, their boosters were approved for by the FDA. And you have to understand there's two different levels of approval. There's emergency use authorization, then there's a final approval. And then there's a third thing with the CDC recommendations. So the final approval is the final approval from the FDA. Pfizer's, they've looked at the data, there's enough data, they've been judged to be safe and have good enough efficacy that they are now approved, period, Pfizer, but they've also been approved boosters for persons who are 65 years of old or at higher risk of severe COVID-19. And so someone say, well, how do they come up with that? Because I actually watched all of the hearings on this stuff. That's a part of my job, is that they do a risk benefit analysis, and they decided that the risk to persons in these particular groups, persons at high risk, so we're talking about folks with underlying conditions that may be, may make them susceptible, and that could even be obesity, is one of the things they talked about, but a high blood pressure, things like that. So if you're at high risk of severe COVID, your doctor would be able to say whether you're not or not. And if you're 65 years old, again, because your immune system is not the same, that the benefit far outweighs any risk. So they approve boosters for them. Again, check with your physician to see if you're interested, if you qualify. Make sure you check with your physician. That's not to be confused with the CDC's recommendation of a third dose of Pfizer or Moderna, the mRNA vaccines, for persons who are immunocompromised. That's a different thing. So you can also get a third dose. That's not really considered a booster. That's just saying because you're immunocompromised, your series of vaccinations is longer. So you need to actually get 3 doses to get your immunity up. Because remember, I talked about those folks, their numbers are so low, they need 3 doses to get to that number, which would be that higher number, the 80s and 90s. I don't think we got the question yet. I was still looking. Okay. Okay, let's see.
No, it hasn't been posted yet.
Okay, I just wanted to make sure I was answering everyone's questions. So our particular project, our vaccine project we worked on, as to date, we have arranged for vaccinations for 272 persons and have set up 8 vaccine clinics. And we've been doing this since late July, pretty much we got really up and running in late July. We have engaged another, oh, this is a typo, I'm sorry, 20,935 individuals with our outreach, in-person events, webinars such as this. And we also have our social media that we do on our website, where we've engaged and provided information for persons and letting them know about our project. But we have also leveraged our greater network, the Texas Partners for Inclusive Access, to send out information or provide education to another 32,763 persons. And by that, I mean, we're not talking about per se, come get a vaccine. Somebody just has questions and we answer questions or we point them to sources. So one of the things we did is we realized this was something bigger than we could do. So going back to the question about collaboration with community partners, we came up with the idea for Texas Partners for Inclusive Access. And we wanted to have a sort of a Susan G. Komen type of approach. I mean, we're not big like that, but approach as far as trying to brand something to let people know that they could trust this information, that this is a bunch of organizations that they're familiar with, and that we could come together and try to get the word out about vaccines. So, and access to them. So we spearheaded the formation of a statewide coalition of organizations, and again, Texas Partners for Inclusive Access. We come together for the purpose of helping Texas with disabilities get vaccinated. Some of our participating organizations, there are more than this, but they include ourselves, the DISHES, HHSC, that's the State Health and Human Services Commission, Texas Coalition of Developmental Disabilities, FEMA, Texas A&M, University of Texas, the ARC of Texas, House the Homeless, National Federation of the Blind, NAMI Texas, we work with them, PAX Tex and PPAT. Those are the organizations that work with individuals who are in group homes. And in this particular one, the Governor's Committee on People with Disabilities, and there are more. There's sororities that have signed on. We're working on now, working with Kroger. They're actually putting out our, in the Austin, Tarrant County area, they're putting out grocery bags with our contact information on it, which is really wonderful.
I have a couple of questions.
Okay.
Do you have any information on state provided, I might not be saying this right, monoclonal infusions for homebound customers or customers without accessible transportation who are COVID positive?
Yeah, if you contact our line, we can work on helping you get access to that. We know that, I know we've been doing research on getting in-home testing. And it's not so easy as to say state provided. A lot of this comes from local health departments. So part of our navigation mission is to try to navigate research for folks, navigate and make phone calls and help them find different resources for COVID. So that's a good question. We don't limit it just to that. So if you ask us about that, we would figure out where it is in your area. I'm not familiar with the state though, actually providing that in the home. As far as I know right now, they're only doing a vaccine. Not to say that hasn't changed. I haven't spoken to them in a while, and I know they've been adding some other things, but that's a good question. That's something I will find out about because I'm due to talk to them this week. But if you call us though, we would do our best to try to locate that for you.
Another question about public health departments. This is kind of lengthy, but basically it's asking, big towns and larger cities are picking up on communication access for people that are deaf or hard of hearing. But what about the rural areas? Are they fully equipped to accommodate people who are deaf or hard of hearing who receive vaccines or other health related assistance, like such as questions on vaccines, boosters, any kind of preventative education, information about the variants? Do you know anything if the rural areas are, and I'm assuming this probably means, you know, providing interpreters for people that are deaf or hard of hearing, things like that, to make sure communication access is occurring?
The answer to that is it depends. Some are better than others. If someone were to point out to us an area that is not providing that, we would contact them and work with them to get something up and running. We have done that. When it started, we had some of the bigger areas weren't doing it. To be frank, there were things the state wasn't doing that they've done a good job of cleaning up last time I checked. But we're always on the lookout for that. But I've seen some smaller areas, they're fantastic. And sometimes you get some places, they'll tell you maybe it's because of the resources they have or whatnot, they're not set up to do it. And we would, you know, work with them to try to get an accommodation and something set up. So we have such a big state. I can't say, I can say that it's better than it was when it started. When it started, it was bad, but I'm pretty sure there are places that I'm not aware of that are not accommodating people fully, and that's something we would definitely want to look into. In fact, I know it there are, because there always is. I mean, it could be some small town, it could be a big one. I mean, we just haven't gotten a call on it, so we're not aware of it. So yeah, I can send a copy of, I'm looking at the question about a copy of the slides. I can send that to Randy, and I guess she can make it available to you.
Yes, ma'am. Yes, sir.
No, that's fine.
We do a follow-up email about 24 hours later that includes a link to our website where we post the recording. It may take a day or two to get the recording up, but also the training materials, including the transcript.
Okay.
And that's all the questions I see posted.
Oh, these are all great questions. And no, all questions are welcome. So how do we help? Again, I mentioned this earlier, we have on standby vaccine navigators to assist persons with disabilities overcome barriers to getting vaccinated. Additionally, our vaccine navigators can assist with giving information regarding vaccine availability, safety, and efficacy. And we also can address any questions related to vaccine hesitancy. And again, in fact, next time I do this, I'll add to this slide. We'll also address any questions in general that you may have regarding, you know, treatments or whatnot. Now, and again, let me say this with that caveat. We're not doctors. We don't pretend to know everything, but we can cite you to, we can point you to well-trusted sources and get you information. But again, I would tell everyone over and over again, consult with your physician to make sure that whatever course you take, whether it's a treatment, whether it's the vaccines, is right for you. But because they would know better than anyone, right? So the magic number, if you want to call us, and I'll say this out loud, 1-800-880-8401. Once again, that's 1-800-880-8401 from 9 a.m. to 4 p.m. 1-800-880-8401. And it might go to voicemail, but most times we're able to pick up. I would say 85% of the time we're able to pick up. But we also have, if it's easier, this is 24 hours, you can email us. I know a lot of persons prefer to email. vaccine@drtx.org, vaccine@drtx.org. I'll spell that, VACCINE, the @ DRTX, DRTX.org, like dog radio, Texas X-ray.org. And you can send that anytime. We should get back in touch, unless it's on a Friday. We should get back in touch with you within about 24 hours, 48 at the latest. But we try to get back to, and that's something we monitor. We try to get back to everyone as quickly as possible. We have about, that concludes the presentation. We have about 8 minutes left.
We have a couple more questions.
Yeah.
What about people with disabilities needing the COVID testing at home? Do you provide that?
That's something that we are, some of the health departments do throughout the state, and that's something we could try to help arrange with. But it depends on where you are. The tests, we found some places do it, some places don't. But that's something we've brought up, and that is an issue that individuals are homebound being able to get access to tests. It's a major issue.
There's another question related to the people who are homebound. Another need of people who are homebound due to compromised immune systems is in-home blood draws to test for post-vaccine antibody response. Most testing seems to be for post-COVID infection antibody levels. Can you add that to your list to research, please?
Okay, could you read that for me again?
Sure.
Randy, make sure I got that.
People who are homebound due to compromised immune systems is in-home blood draws to test for positive vaccine antibody response. Most testing seems to be for post-COVID infection antibody levels.
Okay, I understand.
And
yeah, I will look into that. So you're saying, if I'm understanding the question, to see whether or not how much they actually responded to the vaccine, to see if their antibodies came up as opposed to being infected, and whether or not they are still positive or had a, yeah, okay. That's a good question. That has not, that's a very good question. And I can say that that has not come up, but that's a good point. That's why I like doing these. I learn more from talking to folks than I tell them. Yeah.
And one more about, you were talking about being joining the coalition, the TPIA coalition. How do they do that again? Should they just email you?
The easiest way would be to email us, but once you email me, you can email that, and then that's how you contact us. And then we can send you a, we call it a request for commitment survey, and you fill that out, and then we can add you. It lets us know what, these are the activities we have, or roles, and which ones that you may or may not want to be involved in. Like I said, Randy's organization, the governance committee, they're a part of it. So one of the things they told us was they would help with outreach. So here we are. See, that's how it works.
What about the newer vaccines? Do you facilitate the latest ones for people who are otherwise unable to access healthcare, but know much more than you apparently do about safe and effective vaccines? Does that make sense?
Yeah, when you're saying the newer vaccines, there are only 3 that are widely in use in the United States. There's Moderna, there's Pfizer, and there's Johnson & Johnson. Moderna, I forget the number. Moderna is the most effective, but Pfizer is right below it by a percentage point. I think Moderna is like 94, 95, and then Pfizer is like 1 point beyond that. Johnson & Johnson, those are 2-dose mRNA vaccines. Johnson & Johnson is a 1-dose vaccine, and it's in the 70s, like 74. And these numbers vary as they get more data, so I can't lock in and tell you the exact number. The more data they get, the number goes up or down. But it was like 74 the last time I checked. That's 1 dose. There's another one that was supposed to come online. It was an AstraZeneca. I'm not aware that that's come online, and I'm also not aware of that being really distributed here in Texas. I've never heard anybody getting AstraZeneca. So there's really those 3. And so when you say newer, I don't know if you mean
I'm not sure.
boosters, or I'm not sure, but there's really only 3. So
And kind of another question about the webinar is in providing this information. One of the the mayor's committees on people with disabilities is asking, can you do this more concisely in about 20 minutes for a mayor's committee on
yeah,
people with disabilities virtually?
yeah,
And I'll get you, well, you've got Sean's contact information there, just email him.
yeah. I've got, and let me give you my direct. I'll give you my direct line. How about that? Okay, everybody's ready. You call me directly.
Okay, I'll put it in the chat box too.
Okay.
Go ahead.
832-681-8212. 832-681-8212. Or you can email me directly at sjackson@drtx.org. sjackson@drtx.org.
All
Yeah,
right,
you got
in the
'em.
chat box for everybody.
Yeah, and I've got like 5 versions of this. I've got one I can do in 15. I got one I can do in 10 minutes.
Do you know of any new definition of vaccine as it has been changed? Anything that provides protection, such as HCQ, IVM, and Taraxium, TARAXACUM?
I can say about the vaccines that when they were talking about the boosters, I don't know if this is going to answer your question, but I think this is what you're asking. When they were talking about the boosters, there was a debate in the doctors, the panel met. There was a big debate on whether or not they should hold off on the booster and go to a new version that had a different formula. And that would be dealing with the more newer strains and other things they found out. It was decided at that time, which was a week ago, that the current vaccines were still preventing hospitalization and preventing death, to where they didn't feel like there was any reason to change the formula. Now, other nations, they're doing some different things, but that's because they're looking at it differently. Some of the other nations are looking at it as preventing any type of illness whatsoever. Our whole deal in the United States is to keep folks out of hospitals because of the stress I talked about to our system not being able to take it. So as of right now, they have not changed the formulas because they're still keeping that baseline of keeping folks out of hospitals and severe illness. I gave you those numbers earlier. I mean, they're very, very low, like in the thousands of a percentage.
And I think you answered this one very early on. How long has the vaccine been around? You said they started working on something related like 10 years ago. It wasn't this exact.
Yeah, it was about 10 years ago, if I recall reading. It was about 10 years they've been working with mRNA. Here's the thing about mRNA vaccines. There's actually a school of thought that this particular science could actually vaccinate against cancer. I don't know if that's going to happen or not, but to show you it's and it doesn't change your DNA. It doesn't do anything like that. So that's another thing people ask me all the time. It does not change your DNA. But it's a new science that not that new. It's been around for, like I said, about a decade. But there's a lot of applications of it that they're exploring.
Well, thank you, Sean, so very much for being here today. This has been very enlightening, and we're so glad to see that you have such a project. I want to thank the interpreters as well as our transcriber, our CART provider, and I hope that the rest of you have a really wonderful afternoon. Thanks for being here. We're going to say bye.
Thank you, Randy. Thank you, everyone. Thank you.